Hello friends, welcome back to our YouTube channel Doctorscorner. Today we are going to discuss a very important disease related to central nervous system, Parkinson's disease. Okay, so this is very important as far it is concerned with the MBBS students. For MBBS students in the subject Physiology, under the section of basal ganglia, it can be asked as a 5 mark short note, Parkinson's disease. Okay, and in the subject Pharmacology, the drugs related to Parkinson's disease, and finally in the subject internal medicine or general medicine. So this can be a very important long essay question regarding the Parkinson's disease. Okay, it's a very common clinical condition which is affecting the central nervous system. So in fact it is the second most common neurodegenerative disorder. Okay, neurodegenerative disorder all over the world. First is Alzheimer's disease. After that, the second most common neurodegenerative disease is Parkinson's disease. Okay, so today we'll discuss this particular topic, Parkinson's disease, under this following side headings or the objectives. First, we will have a quite introduction about this disease. Then we'll discuss most important signs and symptoms or the clinical manifestations of the disease. Then we'll try to discuss the cause, and finally the pathology or the pathogenesis of this particular condition of Parkinson's disease in this particular lecture today. Okay, since we need to discuss about the management and also the diagnosis part also, we will discuss in the second part. So in this part 1 video of the Parkinson's disease, we are going to discuss this particular side headings or the sections related to the Parkinson's disease. Okay, now as I already said, it is the second most common neurodegenerative disorders. That is, it is a disorder related to central nervous system. Now, which part of the central nervous system is affected? Here is the substantia nigra, that is a part of the basal ganglia. Okay, to make this point more clear, I request you to go back to our playlist of Doctor's Corner. In the subject Physiology, we have discussed in detail about basal ganglia. So, in the basal ganglia, they are the masses of the grey matter in the central nervous system. So, in that, in the midbrain, especially upper part of the midbrain, there is a substantia nigra. So in this substantia nigra, there are two parts, pars compacta and pars reticularis. So in the pars compacta of the substantia nigra, the neurons which are secreting the dopamine, they get degenerated. Okay, and due to the degeneration of these neurons, there is a problems related to the movement of the body or the motor system. So especially it will affect the motor system of our body. So motor symptoms are more common. However, there are certain non-motor symptoms also that are also common, but mainly it's a disorder which is affecting the motor system of our body. Motor system is related to the locomotor system, that is the muscles, joints and the nerves. Okay, so mainly it will affect the motor system. And why it will affect the motor system? Because the part of the brain which is controlling the movements, that is the planning and initiation of the movements and all, so that part is getting affected. It is the neurons in that part which is secreting the dopamine, they get degenerated. Why they will get degenerated now we'll discuss in the cause, but right now just in the introduction, remember which part of the body is affected. It is the central nervous system disorder, which substantia nigra, dopaminergic neurons are affected and they get degenerated and finally they will die. And it will lead to certain signs and symptoms, and that signs and symptoms is called as Parkinsonism, and if it is idiopathic, then it is called as Parkinson's disease. Okay, so it is a very common Parkinson's disease. More than 7 million people all over the world are affected. Okay, it is very common, and it is estimated by the year 2040 it will be double, that is around 14 million people will be affected by this particular condition of Parkinson's disease. Okay, not only that, every year the disease patients of this disease are increasing, and if we see the male and female ratio, it is around 3:2. Okay, 3:2, that is males are more commonly affected as compared to the females. Then if we see the age, so this is most commonly seen in the elderly age group, that is greater than 60 years. However, there are so many patients who are younger, in the younger age group. Okay, that is a different form of the Parkinson's disease. We'll discuss that later. Right now, it is more commonly seen in elderly greater than 60 years, and almost After 60 years, 1% of the population is affected by this particular condition, and after 80 years, around 4% of the population is affected by this clinical condition. Okay, so it's such a common neurodegenerative disorder. Okay, and it has affected many celebrities or famous personalities too. Just to pen on few, one of the most common or the most famous Parkinson's disease patient all over the world is this boxer Muhammad Ali. Okay, Muhammad Ali. So he developed the Parkinson's disease in the age 42 years only. Okay, and it actually started at the age of 38 years, but finally it was diagnosed at the age of 42 of this boxer Muhammad Ali. Okay, he suffered from this particular disease, and other notable public figures, actor Michael J. Fox, American actor. So there are others also who were affected by this particular clinical condition. We'll discuss about that some other time. So it was first time this particular disease was discovered by an American physician, James Parkinson. James Parkinson in the year 1817. Okay, so actually he was an English physician. He used to see the patients. So he has just seen a few patients, around 4 to 5 or even 6 patients. So in that he noticed particular signs and symptoms like tremors, rigidity, some postural abnormalities and all. Then he coined this term Parkinson's disease. So he published an article, an essay on shaking palsy. Okay, so he published an article, an essay on shaking palsy, an essay on the shaking palsy in the year 1817. So after that, this concept was clear to the mankind, and many such research was done on that, and on his name, James Parkinson, this disease was kept as Parkinson's disease. Okay, so with this introduction, let us finally see the signs and symptoms of this particular disease. Signs and symptoms or the clinical manifestation. So as I said it will mainly affect the motor system. Okay, so it will have a classical signs and symptoms related to motor system. Just to remember, you can remember this mnemonic TRAP, T-R-A-P. So I'll just tell what does it stand for. T stands for tremors, R stands for rigidity, A stands for akinesia, and finally P stands for postural abnormalities or postural dysfunction. Postural abnormalities. Right, just to remember this word TRAP. So these are the classical signs and symptoms seen in this particular condition, Parkinson's disease. So let us discuss all these motor symptoms. However, it is having the other motor symptoms and the non-motor symptoms too. So the most common motor symptom is the tremor. So it is a coarse resting tremor. So usually it will start on one side, for example on the right side. So and as the disease progresses, it may become bilateral. So it is a coarse resting tremors, that is during the rest, and when a person tries to do certain activity, the tremors will subside, and the frequency of the tremors is around 4 to 6 times per second. Okay, like this. And classically these tremors are termed as pill rolling tremors. So earlier in the earlier days, for making the pills, they used to roll like this, and they used to use the thumb and the index finger for making the pills. This is typically known as pill rolling tremors. So similarly, so this type, okay, slow course pill rolling tremors, okay, usually unilateral, and it will become bilateral, and it is a resting tremors. So one is tremors. Then second important symptom what we see is rigidity. Now what is this rigidity? Rigidity simply means there is increase in the muscle tone. Now what is muscle tone? So you see, whenever you try to passively flex someone's someone's joints, okay, so muscles will offer certain type of resistance. That resistance is known as simply muscle tone. Okay, so usually you will find some resistance, but in this particular condition the resistance is increased, that is there is increase in the muscle tone. Okay, so that is known as rigidity, and classically it is termed as lead pipe rigidity. Lead pipe rigidity, as if you are bending a lead pipe. Okay, if you try to flex someone's elbow here like this, you will feel it like you are bending a lead pipe. So that's why it is termed as lead pipe rigidity, because the muscles become stiff or rigid. However, it is different from spasticity due to the upper motor neuron paralysis. We will make some other video to discuss the difference between spasticity and rigidity. Right now, you just remember this extrapyramidal symptom which is causing due to in the basal ganglia lesion, that is rigidity. The muscles will become hypertonic and rigid, that is lead pipe rigidity. And if it is associated with tremors, then you will find some sort of interruption like this, typically known as cogwheel rigidity. Cogwheel rigidity. So lead pipe or cogwheel rigidity, that is rigidity as so plus tremors, cogwheel rigidity. So these are the signs and symptoms, motor symptoms of rigidity. Then we have the akinesia or bradykinesia or hypokinesia, that is decrease in the initiation of the movement. So basal ganglia, substantia nigra neuron, basically they are involved for the movement, that is planning and execution of the movements, okay, programming and planning of the movements. So the movements are decreased, okay, the movements are decreased, that is known as, or sometimes absent, that is akinesia, or decrease means hypokinesia. Then finally the postural problems or postural abnormalities. So there is a stooped posture, the person will be bending like this in front and is having a short step shuffling gait, shuffling short stepped gait. So this type of motor symptoms you can remember by the word mnemonic: trap, tremors, rigidity, akinesia, and postural abnormalities. Okay, remember these are the most common motor symptoms. Not necessarily all patients should have all these things, but majority of the patients will have these signs and symptoms. Now apart from this, there are other motor symptoms too. So let us discuss briefly what are the other symptoms we can see. One is small handwriting. We see in 50% of the patient, which is known as micrographia. Micrographia. So what is micrographia? A decrease in the size of the words or the handwriting, or the font size is decrease. Okay. For example, in this particular picture you can see, if suppose this is the normal handwriting of a person, then if the same person develops the Parkinson's disease, then the handwriting will be, it is like this, micrographia, it will become small, the font size will decrease. So it is shown like before and after L-DOPA treatment. Okay, there is a treatment for Parkinson's disease. L-DOPA we will discuss in the management section. So before L-DOPA, that is person suffering from this, they will have the small handwriting. When we give this after L-DOPA and the Parkinson's disease improves, then the size will become normal. Okay, that is micrographia. That is one of the diagnostic thing. Then another is masked face. So due to the akinesia or bradykinesia, the facial expression muscles, okay, so they don't work properly and the face will become like a masked face. They don't show any expression, even if they are smiling, frowning, whatever they do. They try to show the expression, but ultimately it will appear as expressionless face, like a mask-like face. Okay, this is also one of the diagnostic feature. Then reduced blinking rate, again due to the motor symptoms, the eyelids which are blinking normally, so because of this the blinking rate is reduced and it will lead to dry eyes and other symptoms. Okay, then again drooling of the saliva is commonly seen. Okay, drooling of the saliva. Then another one is hypophonia or the soft voice or the low voice, that is the volume of the voice is decreased, soft voice. So this is seen in around 75 to 90% of the patients. Okay, and sometimes it will occur before the main motor symptoms of rigidity, tremors and akinesia. Before that only the voice become very low volume. Okay, a soft voice. This is also one of the diagnostic feature or symptom of the Parkinson's disease. Then dysphagia, difficulty in swallowing. Again, it is related to the motor system, muscles of the pharynx and the muscles of the mastication and all. They will find difficulty to swallow the food. Then these are the motor symptoms. So apart from this, there are certain non-motor symptoms also, which are very much common in the Parkinson's disease. So the non-motor signs and symptoms are, so I will just spend on the important one. Anosmia, that is loss of smell sensation. Okay, again this is also very common and it is seen, it will precede the motor motor symptoms. So many times the patient will first present with this symptom that he is unable to make out the smells of the various substances. Okay, so that is known as anosmia or hyposmia, and also even the taste sensation. Okay, that is known as ageusia. So taste sensations are also lost, but anosmia, loss of smell, is one of the characteristic clinical finding. Then pain, generalized musculoskeletal pain, it is seen in most of the patients, almost 75% of the patients. Musculoskeletal pain is seen because of this rigidity and all, muscle rigidity. There is a classical pain is seen, and also neuropathic pain in 5 to 30% of the patients. Then we have neuropsychiatric and cognitive impairment. So the commonest neuropsychiatric problems what we see is depression and anxiety. So why there is depression and anxiety is, as you know, there is the main pathology is there is a degeneration of the neurons. So neurons will usually release certain neurotransmitters like dopamine and all. So there is an imbalance between the dopamine and acetylcholine or the other neurotransmitters, which will affect your psychiatric behavior, and it will cause the depression and anxiety, and it will also causes the sleep related disorders. So it may cause insomnia or REM sleep abnormalities is seen. Okay, sleep disorders. Then cognitive impairment, that is the thinking ability, the decision making ability, the cognitive power is also affected because of the degeneration of the neurons here. Okay, so it will affect the general well-being and the lifestyle of a person. Okay, it will lead to the severe morbidity, and it will reduce the patient confidence, and also there is a dementia, that is loss of memory. Okay, so this all non-motor symptoms are seen, and one more very important non-motor symptom is autonomic dysfunction. So as you might be aware that autonomic nervous system is another part of the nervous system that is controlled by the sympathetic and parasympathetic division of the autonomic nervous system. So in this particular condition, there is a dysfunction of this autonomic nervous system, which is usually controlled by the neurons of the hypothalamus and the other centers in the brain and the spinal cord. So autonomic dysfunction, for example, in the cardiovascular system, it may causes orthostatic hypotension. That is, whenever the change in the posture from lying down to the sudden standing position, there is a decrease in the blood pressure. That is known as orthostatic hypotension. Then in the GIT problems, one of the most important one is the constipation. Okay, nearly 50% of the people suffer from this particular disease of constipation. Okay, constipation. Then even the genitourinary problems, genitourinary symptoms like urine dribbling and all can be seen. So these are the certain autonomic dysfunctions are also seen along with the motor symptoms. Okay, so this is all about the signs and symptoms of the Parkinson's disease. Now let us discuss what is the cause, why exactly it will occur. I have already said in the introduction, so mainly the neurons which are present in the substantia nigra are affected. Okay, so usually in 85% of the cases it is idiopathic. Why the neurons get degeneration, nobody knows. Still research is going on. It is idiopathic, but few hypotheses or few theories it suggests that it is due to the genetic or environmental causes. Okay, and few are some secondary causes. Okay, secondary causes are there. Rest condition that is known as secondary Parkinson's disease. We'll discuss about this in the classification of the Parkinson's disease. The most common is the idiopathic one, that is the Parkinson's disease we are discussing. For example, on secondary Parkinson's disease, MPTP, okay, one heroine, in that this chemical MPTP was used that will affect the substantia nigra neurons, and it will cause Parkinson's disease in the young individuals. Okay, so there are other causes also for the Parkinson's conditions. This motor symptoms what I have classically described you, tremors, akinesia and rigidity, these together, together they are called as Parkinsonism, and This can be seen in various other conditions, but if it is due to idiopathic cause, then it is known as primary or idiopathic Parkinson's disease. And the other names of this Parkinson's disease is shaking palsy, paralysis, agitance, or hypokinetic syndrome. Okay. Now, this may be the cause, either genetic or environmental. Still, so many researches going on regarding the cause. So, the main pathology here is due to the degeneration of the neurons in the substantia nigra, and there is mutation in the protein synthesis of alpha synuclein. This one of the proteins which are present, it gets mutated and misfolded, and it gets accumulated in the form of the clumps. That clumps together, they are seen as Levy bodies. Okay, so these Levy bodies are seen in the substantia nigra in the autopsy of the patient suffering from the Parkinson's disease. This is one of the pathology. And pathogenesis, why exactly a person will get this hypokinesia, rigidity, and tremors. To understand this, please go back to the playlist Physiology in our channel Doctor's Corner, where we have studied about basal ganglia. In that lecture of basal ganglia, we have discussed how this dopaminergic neurons of the pars compacta of the substantia nigra will help in the planning and programming of the movements by direct and indirect pathway or the connections of the basal ganglia. So you will understand if there is damage, then why there is a hypokinesia, rigidity, and tremors. Okay, if possible, in the next video we'll discuss about the mechanisms also. So we'll quickly end this video by this. So just to revise what we have discussed today, we have discussed about the introduction part, then we have discussed about the signs and symptoms and the cause and the pathology of Parkinson's disease. However, when we have not discussed in detail pathogenesis, in the next video we'll try to discuss in detail pathogenesis and classification of the this particular disease and the diagnosis and management. Just before ending, I'll just let you to know something known as World Parkinson's Day. Okay, it is celebrated on 11th April every year. Okay, it is the birthday of Dr. James Parkinsons. Okay, so on his birthday, World Parkinson's disease. So the symbol of this Parkinson's disease is this red tulip, this flower, and the stem of this flower, you can see there is P and D, Parkinson's disease. This is the symbol of the Parkinson's disease. On 11th April, World Parkinson's Day is celebrated. Okay, so hope you like our presentation. If so, please subscribe our channel and share the link with your friends. And please stay tuned with us. We will try to make the second part shortly, in which we'll discuss the remaining part of the Parkinson's disease. Okay, thank you.